Hello dear doctors, and thank you for joining us today for this case discussion. We will be focusing on an often encountered but sometimes overlooked aspect of medical care, a postoperative infection. Specifically, our discussion revolves around a 35-year-old male patient who had recently undergone hernia surgery. Just a week following his surgery, the man returned to our clinic. His symptoms were indicative of a possible infection, a complication that can occasionally follow surgical procedures. He was experiencing redness, swelling, and a heightened level of pain around his surgical site. These signs, though alarming, are quite typical of an infection, but it wasn't just the localized discomfort that brought him back to the clinic. He also reported running a fever, a systemic symptom indicating that his body was fighting an infection. Fever, in this context, served as an important piece of the clinical puzzle, suggesting that this wasn't merely postoperative discomfort or a healing process, but potentially something that required immediate attention and intervention. So today, we will delve into this case, explore the implications of such a situation, and understand how we managed it. This case is not just about learning from an individual patient's scenario, but about how we can apply this knowledge to future patients and improve their outcomes in the postoperative period. Let's dive deeper to better understand the origin and progression of his symptoms. Our patient, a 35-year-old man, had undergone a successful hernia surgery just 1 week ago. Initially, his postoperative recovery seemed to progress smoothly without any unexpected events or complications. However, a few days following the surgery, the patient began to experience increased discomfort. The pain around the surgical site, which was initially manageable and expected as part of the postoperative healing process, began to intensify. Accompanying the increased pain, he also noticed the surgical site's redness and swelling. The patient reported these changes were not immediate but rather had progressively worsened over a couple of days. Of further concern was the onset of a fever during the same period. All these signs together, increased local pain, redness, swelling, and a systemic response in the form of fever, made him rightfully worried, prompting his immediate visit to our clinic. This return to the clinic so soon after surgery initiated the exploration of a possible postoperative infection, a complication that requires timely detection and intervention. During the physical examination, we concentrated on assessing the surgical site and the patient's overall health status. Upon visual inspection, the surgical site clearly exhibited signs of inflammation. The area was notably redder compared to the surrounding skin, a condition medically termed as erythema. It was also swollen, a sign often related to increased blood flow and fluid accumulation in the tissue, a response the body typically mounts against an invading pathogen. Upon palpation, the site was tender, causing the patient discomfort even with gentle touch. The area also felt warmer than the surrounding skin, a characteristic sign of inflammation as the body increases blood flow to the affected area to deal with the infection. Furthermore, when checking the patient's vitals, we recorded a body temperature of 100.4 degrees Fahrenheit. This is higher than the normal body temperature range, indicating that the patient indeed had a fever. A fever is a systemic response, implying that the body is fighting against an infection. Taken together, the localized symptoms at the surgical site and the systemic symptom of fever strongly supported our suspicion of a postoperative infection. It became clear that we needed to move forward with further investigations to identify the cause and severity of the infection, and most importantly, to initiate the appropriate treatment plan as soon as possible. Based on the clinical presentation and physical examination, the patient's symptoms necessitated a deeper look into his condition. Our first step in the investigations involved running a complete blood count, commonly known as CBC. This test provides a comprehensive view of the different types of cells in the patient's blood. In our case, the CBC results revealed an elevated white blood cell count, or leukocytosis. As white blood cells are part of the body's immune system and help fight off infections, an increase in their number often suggests an ongoing infection in the body. This finding reinforced our suspicion of a postoperative infection. To further refine our diagnosis, we ordered a wound culture from the surgical site. This test involves taking a sample from the wound and growing it in a lab to identify the presence of bacteria or other microorganisms. By identifying the specific type of bacteria causing the infection, we could then determine the most effective antibiotic to treat the infection, an approach known as targeted antibiotic therapy. This procedure is crucial as it not only confirms the presence of an infection but also aids in optimizing patient care and preventing potential antibiotic resistance. In the context of our clinical reasoning process, the patient's recent surgical history served as an important factor. Surgery naturally introduces the risk of infection, as it breaches the body's primary defense against pathogens, the skin. Next, we considered his symptoms. The patient reported increased pain at the surgical site, which was a significant change from his initially smooth post-operative recovery. The presence of localized signs of inflammation, redness, warmth, and swelling, at the surgical site, were indicative of an ongoing infectious process. The patient also presented systemic symptoms of infection, such as fever. Fever is a common response of the body to infections, as it aids in the immune response. This provided another piece of supporting evidence for our working diagnosis. Our lab investigations corroborated our clinical suspicion. The complete blood count showed an elevated white blood cell count, which is a typical response of the body to an infection. Furthermore, the results of the wound culture, once available, would help us identify the specific microorganism causing the infection. Given these findings and the overall clinical picture, we reasoned that the patient was likely suffering from a postoperative surgical site infection. This led us to direct our management towards treating this condition. In managing this patient, our main goal was to control the infection quickly and efficiently, while minimizing any additional discomfort for the patient. As the results from the wound culture were still pending, we opted to start with a broad-spectrum antibiotic. This type of antibiotic is designed to be effective against a wide variety of bacteria and is a common first step in treating suspected bacterial infections while we wait for culture results. Once the wound culture results were ready, they provided us with invaluable information about the specific type of bacteria causing the infection. This also included information about the sensitivity profile of the organism, which helped us understand which antibiotics it would respond to most effectively. Using this data, we were able to refine our initial antibiotic choice and move towards a more targeted treatment approach. Following this targeted treatment, the patient's symptoms began to reduce noticeably over the next few days. The redness and swelling at the site of the surgery decreased, and the patient reported less pain and discomfort. His fever also subsided, signaling that his body was effectively fighting off the infection. After a week of this targeted antibiotic therapy, the patient had completely recovered. His surgical site was healing well without any signs of ongoing infection, and all his symptoms were completely resolved. This positive outcome underscores the importance of swift and accurate diagnosis, as well as evidence-based management in the treatment of postoperative infections. In reflecting upon this case, we are reminded of the importance of vigilance and prompt action when it comes to managing postoperative complications such as infection. The patient's condition could have worsened without timely intervention. Furthermore, this case underlines the significant role of appropriate management. We quickly initiated a broad-spectrum antibiotic and then adjusted our treatment based on the wound culture results, a step that contributed to the successful resolution of the infection. This case also prompts us to re-examine our surgical practices and postoperative care protocols. Every step, from the operation theater to the recovery room, is crucial in minimizing the risk of infection. This includes strict adherence to antiseptic techniques during surgery, careful monitoring during the postoperative period, and patient education about signs of complications. By staying committed to these principles, we can continue to improve patient outcomes and reduce the likelihood of postoperative infections. Let's now look at how evidence-based medicine played a part in the management of this case. The strategies implemented to handle this surgical site infection, from the initial broad-spectrum antibiotics to the subsequent, more specific treatment, were in line with established guidelines for handling such complications. These guidelines, which are built on a foundation of thorough research and years of clinical experience, recommend rigorous wound care to prevent further contamination and promote healing. Targeted antibiotic therapy, tailored to the specific pathogen identified through culture and sensitivity testing, is a cornerstone of these guidelines. In this case, the organism was sensitive to the initially prescribed broad-spectrum antibiotics, so the therapy continued until the patient's symptoms completely resolved. In certain severe cases, guidelines also suggest a surgical intervention to clean the wound, a process called debridement. In our case, the infection was controlled effectively with antibiotics, and surgery was not necessary. Therefore, it's clear that evidence-based medicine was crucial in guiding the successful management of this patient's post-operative infection, highlighting the importance of keeping current with medical guidelines and integrating them into our clinical practice. As we draw our case study to a close, it is clear that postoperative infections, though a frequent occurrence, can escalate into severe health complications if not detected and managed promptly. This case is a testament to the importance of vigilance and the quick action required in postoperative care. The redness, swelling, pain and fever our patient experienced are classic signs of an infection that healthcare professionals, patients, and caregivers should be on the lookout for following surgery. Equipping patients with the knowledge of these symptoms before their discharge is crucial. We must stress the significance of timely medical consultation to avoid exacerbating the situation and to allow for the most effective treatment. Looking forward, our action plan should focus on strengthening these key areas. This includes optimizing preoperative procedures, ensuring meticulous sterile techniques during surgery, and improving postoperative care, with an emphasis on proper wound care and patient education. The goal is always to maximize patient outcomes and ensure the highest quality of care. These efforts will not only reduce the rate of postoperative infections but also allow us to manage them better when they do occur, minimizing their impact on patient health and recovery. In this slide, we reflect on our case management and the lessons we've taken away from this case of a 35-year-old male with a postoperative infection. Our patient's management was effectively and promptly undertaken, which is a testament to our healthcare team's commitment and professionalism. The elevated symptoms post-hernia surgery were caught early, lab investigations were expedited, and treatment was swiftly initiated, all of which contributed to the patient's successful recovery. However, reflecting on this case also underscores the need for growth and improvement in our practices. One area that stands out is patient education. Providing comprehensive information about postoperative care, including signs of potential complications, is crucial. Ensuring patients are fully equipped with this knowledge can make a significant difference in the early detection of complications. If our patient had been more aware of the symptoms indicative of a postoperative infection, he might have sought medical attention sooner, leading to even earlier intervention. Improving our approach to patient education can lead to better patient engagement, more prompt treatment initiation, and ultimately, better patient outcomes. We are reminded through this case that we should continuously strive to enhance our communication and education methods to ensure our patients are well-informed and active participants in their care. This case has provided valuable lessons and reinforced the importance of vigilance in postoperative care, the value of patient education, and the need for swift action when complications arise.